If people could see how I was at the age of 5, I could not climb stairs without passing out. I had a lung collapse in the hospital, and we just weren't sure if I was gonna survive. But now, as I'm a senior and 18, I'm perfectly healthy, for a PH patient. Hope is the key to dealing with pulmonary hypertension in your life. You have to believe in hope.
Emily is one of more than 30,000 Americans currently receiving treatment for pulmonary hypertension. Many more people have PH but don't know it. Early diagnosis and treatment are critical. Without treatment, most patients live fewer than 3 years past their diagnosis. And while available treatments are improving the prognosis for PH patients, there is currently no cure. PH is a relatively rare disease, but there are some risk factors that make developing PH more likely for some people. For example, a family history or genetic markers for the disease. Being a woman, particularly one of childbearing age. Sleep apnea accompanied by obesity. Taking certain drugs, such as methamphetamines and the diet drug fen-phen. And having other diseases, such as congenital heart disease, lung disease, liver disease, scleroderma, lupus, HIV, and sickle cell anemia. But while PH is more common among certain segments of the population, it can strike anyone at any time.
Back in the early 90s, I was stationed as a military officer in Europe with my family. I had 3 children. My oldest child was a daughter named Megan. A perfect little athlete, gymnast. We had great fun. It was a very happy time in our life. And I'll never forget the day when at Walter Reed Army Medical Center, the doctor called me around the corner and said, "Colonel Hicks, I regret to inform you, but your daughter has less than a year to live."
I can't speak to a patient and say, this is what we're going to do to fix it. All I can do is say, this is what we're going to do to try and make things better.
You guys, so you've had a long day today.
One of the big motivations, in addition to this, trying to reduce the symptoms, to eliminate the disease.
For most patients, the prognosis is much better today than it was 25 years ago, due in part to a better understanding of how pulmonary hypertension affects the body.
Pulmonary hypertension is actually very simple to understand. It's basic plumbing. There's high pressure in the blood vessels, the pipes that carry blood through the lungs. The cause of the high pressure is a narrowing of the blood vessels, the pipes, by any of several mechanisms. The problem really comes that once those blood vessels are diseased and cause the high pressure, there's a more difficult time for oxygen to get into the blood vessels, number one. And because the high pressure is in the lungs, the right ventricle, which has only one function, and that is to pump blood through those blood vessels, is overworked. And as a consequence, it enlarges to the extent that it can to compensate for the problem, and ultimately fails.
While doctors today understand more than ever what PH is, diagnosis can still be difficult. The symptoms of the disease often mimic other, less serious conditions, particularly in the early stages.
As parents, when you see your kids day in and day out, it's hard to recognize changes. But the 2 things that really stand out in my mind is, I remember one 4th of July in which Emily was riding in the parade with a bunch of kids on their bikes, and Emily couldn't keep up. And then one day she came down the steps in the morning when you should be rested most, and she was so out of breath she had to sit down on the bottom step. And this happened for a couple of mornings in a row, and then we noticed some bluish tinge on her fingernails and her lips, and it became obvious that she wasn't getting enough oxygen.
In addition to shortness of breath, the symptoms of PH include feeling tired or worn out, chest pain, dizziness or fainting, depression, dry cough, swollen legs and ankles, and Raynaud's phenomenon, in which the fingers turn chalky white or dusky blue. In advanced cases of PH, these symptoms can occur even with little to no exertion. In addition, patients may experience an irregular heartbeat, a racing pulse, sudden fainting, and difficulty breathing even at rest. While pulmonary hypertension is still life-threatening, advances in research and treatment are changing the face of the disease. More and more, patients are empowered by hope. For more information, visit www.phassociation.org and www.phaonlineuniv.org.